Good morning. I thought we'd start out this morning by making some brief comments about Nancy Reagan. Um, I got the honor of getting to know Ronald and Nancy Reagan very well. Um, I think the media has done a good job of pointing out uh, what a devoted couple they were, how they loved each other, and how she was very committed to protecting her husband in all ways. And I had the opportunity in 1976 during the district uh, caucuses in Iowa. I was in charge of the Northwest Iowa Congressional District, and Ronald Reagan came to speak to our district caucus at the Hotel Savory. There was a big crowd around there, so I wanted to brief him before he came in and spoke to the district caucus. In those days, there was a phone booth at the top of the stairway at second floor of the Savory. So Ronald and Nancy Reagan and I got in that phone booth, the three of us. So that's really up close and personal. And I got the opportunity to brief the president. I could kind of see just in Nancy's face that she was kind of worried, but I gave a briefing, and Ronald Reagan out and gave a wonderful speech to the district convention. And even though all the party leadership, the governor and pretty much all of the people in the Central County were all for Ford, we were able to basically get about half the delegates from Iowa for Ronald Reagan. So it was a great experience, and I got it. And then as governor, when the Reagans were in the White House, of course, on Sunday night during the winter meeting, the president and first lady host the governors, and actually this year, my wife Chris and I were at Mrs. Obama's table, but that is always a wonderful experience. And Nancy Reagan was always a great host. I always say my wife sat next to Donald Reagan as his last supper at the White House because he was gone a couple days after that. So with that, I want to turn it over to the Lieutenant Governor.
Oh, to
You
give some
wanna say
comments.
something?
I'm sorry. We didn't practice that. Well, I too just wanted to say how much I think most of the comments that I saw over the weekend when they talk about Nancy Reagan was about how she served with grace and dignity and class. And they were two great American heroes who really did love this country. And I think something that we should all aspire to in the environment that we're in today. So she truly was a great American. She was a great role model and really led with class and dignity. So sorry, Governor.
No,
Thank you.
yeah.
She is said to have had a role in firing the campaign manager after Iowa 80. Did you talk to the couple at any point during that?
Well, I kept trying to get, well, in that Iowa 1980 campaign, John Sears was in charge of the campaign, and he would not return my phone calls. After I'd been very involved in the Reagan campaign in 76, and I had been elected lieutenant governor in 78, although I was officially neutral, obviously my heart was with Reagan, and he wouldn't even return my phone calls. After Iowa, what my message was just what the Bushes are doing made a lot of sense. They were going to, between the George Bush and Barbara Bush and their sons, they were going to all Iowa 99 counties. And that has always been a pretty good strategy to win Iowa. And Sears thought all I had to do is do one rally per congressional district. And Reagan, the great communicator, would carry the state. Well, I could see that wasn't working, and he would not return my phone calls. But as soon as Iowa was over, and I'm sure Nancy probably played a role in this, Sears was fired. But this is what I thought was politically astute. It wasn't announced until 15 minutes before the polls closed in New Hampshire. So they didn't want firing the campaign manager to hurt and they went and they did in New Hampshire what they should have done in Iowa. They went all over. There was that famous instance of the debate where he said, I paid for this microphone. And he really turned around the campaign and went on to win the presidency, but also then George H.W. Bush as his vice president. So I think a lot of people say that Ronald Reagan was such a nice guy and, you know, really built such a great relationship with a lot of people. But uh, Nancy, I think, had a very good political antenna and wasn't afraid to whisper in the president's ear if there were changes that should be made or people that she felt were not being loyal to the president.
Do you recall when she visited here when you were governor back in the 80s? Do you recall what that was for? Because I can remember being at Kirksville, you hosted her.
You know, I don't remember the specifics of that. I do know that she was very involved in Just Say No to Drugs. It might have been with regard to that. You know, we've had a lot of visitors over the years, but she was always very gracious and really certainly somebody that was fun to be around and I think represented our country very well. And so she's going to be greatly missed. Interestingly enough, our friends, the Grubs, are in Thailand with Michael Reagan right now. So that's the adopted son from the previous marriage. And so Michael, actually, I don't think is going to be able to make it back for the memorial service because my wife just got an email from the Grubs today saying they're with him in Thailand. So with that, I think we're ready to go on to talk about the subject of the day. But it is, I think, important to pause and take note of the important role the Reagans played in kind of revitalizing America and also, frankly, ending the long Cold War and leading to the breakup of the Soviet Union and the increase of freedom and economic opportunities and democracy in much of Eastern Europe that had been behind the Iron Curtain for a long period of time. Okay. So Lieutenant Governor Reynolds and I are pleased to be joined this morning by the Director of the Iowa Department of Public Health, Garrett Claybaugh, and by Dr. Sasha Khosravi from Mercy, Dr. Larry Sievert from Broadlawns, and Dr. Doug Dorner from Unity Point. Iowa is the home to two medical schools. As you know, I was the president of one, Des Moines University. The other is the University of Iowa. And we have about 1,500 medical students in our state. But because we don't have enough residency programs, a lot of them do their residency out of state and they get job opportunities and unfortunately don't come back. So upon graduation, these healthcare professionals will go on to do their residencies and then choose where to locate. And we want more of them to locate in Iowa. Unfortunately, we have lost the number of active physicians in the state. So we're behind in terms of active physicians per 100,000 residents. Even though we train them here, without enough residencies, we do lose. And we rank 41st in the nation in the number of psychiatrists. And with mental health being such an important issue, having psychiatrists is critically important. We know there's a need for more psychiatrists and for more physicians in rural Iowa. And we do have programs to address that. In 2013, in my condition of the state address and the budget that I presented, we asked the legislature to support funding for creating additional medical residency programs in Iowa to retain more physicians, including all types of physicians and physician specialists and especially psychiatrists. Since 2013, the legislature has funded medical residency program each year, I think to the tune of $2 million. And we have $2 million more in the budget for this year. In 2014, Iowa made its four initial awards to start medical residency programs. This state strategy will translate into more physicians staying to practice in Iowa because the history is they do the residency here, they get job offers here, they're more likely to stay. Last year, I signed into law provisions that reduce some of the barriers for medical residency programs to receive funding and increase the ability for significant investments to be made in more costly residency programs like psychiatry. As a result, In November 2015, the Department of Public Health announced 3 awards to implement new psychiatry medical residency programs. These programs will address the state's critical need for recruiting and retaining psychiatrists. And that's one of our big challenges in addressing the mental health needs of the people of this state. These 3 programs are being formed at Broadlawns Medical Center, which Dr. Kendall Reed, who was my dean, is now at Broadlawns, at Unity Point, Des Moines, and Mercy Medical Center in Des Moines. This has the potential to create up to 10 new psychiatric medical residency positions annually in Iowa, in hopes that they are retained in the state after they complete their residency. From my experience at Des Moines University, I know that these residencies are critical to our success in terms of retaining these healthcare professionals. These hospitals will be using the $4 million in state dollars that were awarded through the RFP process to establish the 3 accredited residency programs in psychiatry. And now I want to turn it over to Lieutenant Governor Reynolds to tell you more.
Well, thank you, Governor Branstad. As a resident of rural Iowa, I know firsthand how important it is to have access to medical professionals. It can often be the pinnacle point in a decision to move and live in rural Iowa, or to be forced to locate somewhere else. And if your loved one needs professional medical services, you're going to do everything you can to make sure that they have those services and have access to those services. In order to keep our rural communities resilient, we must keep the focus on putting medical and mental health providers where they are needed. The state has made significant investments in mental health through our redesign efforts and through the Iowa Health and Wellness Plan. Since 2003, the state has invested $312 million plus in mental health and disability programs. And since August, the Department of Human Services has successfully implemented an inpatient psychiatric bed tracking system to help locate more beds quickly when hospitalization is necessary. More public investment into more modern mental health services are being made today than ever before in our state's history. Today's medical residency program announcement will help take another leap forward in those efforts. The new programs will be receiving approximately $1.5 million at Broadlawns Medical Center, $1 million at Unity Point, and $1.5 million at Mercy Medical Center. The programs will use the funds over a 3-year period that runs through June of 2019. Many other states have taken similar steps, and they've had success in reducing the cost of care as well as retaining mental health professionals, and I think it's time that we step up and do the same. We want our best and our brightest to stay in the state and not lose them to other states. You know, just last week, we announced the State Innovation Model grants for the first 6 communities, and these communities, they're implementing population-based community applied health initiatives. And the healthcare community is moving away from volume-based service delivery to a value-based delivery system. And lastly, in late February, Wellmark Blue Cross Blue Shield announced the 15th and final certified Blue Zone community in Cedar Rapids. All of these efforts are part of our continued effort to make Iowa the healthiest state in the nation and continue to help Iowans reach that goal. And now it's my privilege to turn the podium over to Director Claybaugh.
Lieutenant Governor Reynolds, thank you very much. As Governor Branstad mentioned, the law creating Iowa's medical residency program was passed by the legislature in 2009 and signed by the governor at that time. While created, however, the program never was funded until Governor Branstad's recommendation in 2013. The Iowa Department of Public Health was directed to create rules providing an opportunity to create residency programs, as well as expand existing programs to train additional physicians. During the past 2 legislative sessions, the legislature and the governor have agreed to set among the program's priorities funding for psychiatric residency programs. Among the provisions of the medical residency grant program are the following. Awards are made through a request for proposal process that's competitive. New residency training programs proposed to be established are eligible for dollar match of public dollars to private up to a cap. And then there are also provisions to ensure that these new programs that are created have a reasonable period of time within which to get a national accreditation. Earlier this fiscal year, the Department of Public Health opened its RFP process and received 5 applications. And Lieutenant Governor Reynolds has mentioned those organizations that were the recipients of those funds. And as has been mentioned earlier, I have the pleasure to reintroduce these 3 individuals here to my left, Dr. Khosravi, Dr. Sievert, and Dr. Dorner, to talk a little bit about their program plans and the importance of their efforts to better serve Iowans' health needs. Dr. Khosravi, I'll begin with you, and then to be followed by Dr. Sievert and Dr. Dorner.
Thank you. First of all, I'd like to thank Governor Branstad and Lieutenant Governor Reynolds and the Iowa Department of Public Health for this monumental grant. At Mercy Medical Center, it is an honor and privilege to serve our patients, and this grant will allow us to meet the challenges of patients with mental health needs. We are starting July 1st of 2018, very excited and prepared to start a psychiatric residency program that will help immensely with the shortage of providers in our state. Thank you.
I'd like to take just a minute to share with you what Broadlawns has been doing and what we hope to do in the future through this wonderful grant. Broadlawns has been committed to psychiatric care for those in need during its whole existence as a hospital. We currently have a 30-bed inpatient unit, and it's always full to capacity. There's never an empty bed, and Broadlawns has committed to expanding that, and we're in the process of adding an additional 14 beds. Last year, there were 60,000 outpatient psychiatric visits done at our facility. There were also 15,000 in-home visits done by some of our community outreach programs. We currently are in a $30 million building project, which will include renovation of our psychiatric inpatient units in addition to the construction of the new unit, and then also a new facility for our outpatient clinics. Within the last year, we started a fellowship training program for nurse practitioners and PAs who want to get an additional year's experience in mental health training. And we think this is another way we can help meet the needs of our state. And this is particularly true for rural parts of our state. So we've got a very comprehensive mental health program. The missing piece for us has been the ability to train psychiatrists. So this grant is going to be a huge boost to us. We really thank the governor and lieutenant governor for this, and we are looking forward to collaborating with Unity Point to create a residency program. Bottom line is we want to train psychiatrists for Iowa, and I think we can do that. I would also say along with me today is our psychiatric program director, Janice Landy, who may be available to answer some questions also. Thank you.
I, too, representing Unity Health Des Moines, want to thank the governor, the lieutenant governor, and Director Claybaugh and his staff. This is really an exciting state matching grant fund that will help us in the development of a quality psychiatric residency program. We're also extremely happy to be working alongside our longstanding medical education partners at Broadlawns. Both institutions, Larry pointed out the investment that Broadlawns has made both in facilities and programs in behavioral health, and Unity Point has done that as well. And the piece that's missing is the residency program. We have partnered with Broadlawns Medical Center for over 60 years in medical education and have been active partners with them. At Unity Point, we have 100 residents now in 6 residency programs. Our internal medicine, surgery, and pediatric residents spend time on the Broadlawns campus. The Broadlawns residents spend time on our Unity Point campus. And based on our record, both at our institution and at Broadlawns, over 50% of the residents we train stay in the state of Iowa. And we think that is incredibly important as we try to address behavioral health needs in Iowa. The behavioral health needs for Iowa would require more than just psychiatrists, and the development of the psychiatric residency program will also strengthen our already existing strong primary care models, so that behavioral health can be available in the communities through our primary care networks as well. Thank you again. This is a terrific program and a terrific opportunity, and we'd all be very willing to answer questions.
Thank you, Dr. Dorner. So we open it to your questions at this point.
Governor or anyone else there, briefly, why does this need state dollars?
Well, first of all, the federal dollars have been frozen for some time. And so I know this from my experience back at Des Moines University. So there's a critical need for more residencies. And our problem is if our graduates from Des Moines University and the University of Iowa go and do their residency out of state, they tend to get job offers there, and we lose them.
Why do we need government money? That's what we-
Well, first of all, residency, well, it's expensive. And there's a critical need to have adequate health care. We're going through a major redesign of our mental health delivery system in Iowa. And one of the shortcomings we have is not having enough psychiatrists in residence in this state. So that's why when I came back as governor, having had that experience at Des Moines University, saw that as a critical need. I put it in my budget and recommendation. In fact, we had a number of students from Des Moines University in their white coats in the gallery when I announced this. And I'm pleased to say the legislature has responded. And we've put $2 million in the budget each of the last 3 years. This is something that we think meets a critical need, and it's a partnership. The state is putting money in. Obviously, the hospitals are also making a significant commitment to making this work.
There's no requirement that the resident stay in Iowa or work here for a certain number of years.
No, but the history is they tend to stay where they do their residency. And that's the reason why it's critical. And I have observed that over the years. We train a lot of doctors here in Iowa at both the University of Iowa and Des Moines University. But if you break that chain, if they go and do their residency out of state, then they tend to get job offers there and they don't come back. So that's the reason why the more we can get people locally that go to medical school here, and then they do their rotations here, but we need to have them also do their residency here as well. And as you've heard, we do have a number of other residencies available in Iowa, but psychiatry has been one of those areas of critical shortage. And this, we think, will help address it. Well, I think the University of Iowa also has a residency program. So there is already an existing psychiatric residency program there, but there's a critical need here. And obviously, even though they're trained here, I'm sure they won't all stay in Des Moines. There's other places in the state where there'll be job opportunities as well.
Will all of these residencies be for students at the Iowa medical schools exclusively?
No, I don't think that's the way it works. Although we expect that most of them will end up going. If you look at the existing residency programs, a lot of them are students from Des Moines University and the University of Iowa, but not exclusively. So there could be somebody from Creighton or from some other medical school that does a residency here.
In December, someone from DMU asked to pass a law that would forbid residencies in Iowa from being taken by for-profit schools. Did you proffer a bill in that regard, or?
There's legislation.
There is legislation moving. I understand. I'm supportive of that. You do have some of these. I want to be careful about the way I word this, but you have some of these out of the country medical programs that we don't think in many cases have the quality of the medical schools we have here in the United States or in the state of Iowa, and so we want to protect against them taking some of the critical slots.
You said there's no stipulation to stay in it. Why isn't there a stipulation?
Well, historically, I don't think there's ever been. And I think, I don't know of any state that does that. We do have some other programs. We have some loan programs and grant programs that provide incentives for them to stay and practice in our state. I've been very supportive of that. Those have been good programs. And so it's not tied to the residency program, but if they go through one of those other programs, there may be some incentives for that. And oftentimes local hospitals will provide a match for the tuition repayment that comes through the state grants. So there are other programs that address that.
Have those other programs with that stipulation been effective?
Yes, they have been. Yes, they've been very effective. And I think we can give you statistics on that. The problem is psychiatry. We have had significant success in family practice and other areas, but we do have a critical shortage in psychiatry. That's why I'm really pleased that these residency programs are focusing on psychiatry.
I guess, just put a finer point on this, how do you explain to Iowa taxpayers their doctors are gonna go training people to go practice in Washington DC or California or New York?
Well, what happened is we are training them right now and they're doing their residency out of state and not coming back. So by having the residency here, as you've heard, we expect that a significant share of them will stay in the state.
50%.
Right.
So why train the other 50% with Iowa taxpayers?
Yeah, you go ahead.
Sure. Yeah, your point, that's exactly what we're doing now. We're training all these people and they're leaving. And I'm a family physician, grew up in rural Iowa, and we have a 35-year history now with data that shows that if you go to either one of our medical schools and then do your residency in Iowa, there's an 80%, 75 to 80% likelihood that you will spend your entire professional career in Iowa. And so we feel very confident that we can do the same thing in another specialty like psychiatry. So that's really our goal with this whole thing.
Why don't you stipulate it so you get 100%?
Well, you can't. In graduate medical education, it's against the rules.
Yeah.
Dr. Dorner?
I would just reinforce what I mentioned at our institution at Broadlawns and at Mercy. About a third of our residents are graduates of Des Moines University, another third are graduates of the University of Iowa, another third come from other primarily upper Midwestern states. You cannot stipulate where you take someone from. It's a competitive process, as is the job market thereafter. But the statistics are overwhelmingly in Iowans' favor when we train someone from Iowa in one of our two medical schools and then give them their residency training in the state. The statistics for that group is well more than 67% staying in the state of Iowa. So that's a very, very good return on investment. To the cost question, running residency programs are very expensive. These are matching grants. Each one of our institutions are providing at least equal funds and much more to develop these residency programs. So it's a combined private state partnership, which we think, based on our many years of cooperation in medical education, will be very effective in creating more psychiatrists. Sustainability is an issue. All of our institutions are at or above the federal cap for residency positions. Federal funding is a challenge going forward. All of our institutions put a lot of institutional dollars into this because it is part of our education mission. The residency program is a 4-year program, and our residency programs have been around since the 40s. So we will be in business. We'll figure out a way to make it sustainable.
I just want to make sure I understand the appropriations you mentioned. 2 years, excuse me, 2 million every year for the last 3 years. So
Right. And we're intending to continue this.
So I just want to make sure with the approximately 4 million, is this for the kind of upcoming fiscal year, the current fiscal year, and you're just announcing the program now? And why is it 4 million as opposed to 2 million?
Well, the grant was actually started, the first appropriation was made in 2013, but you go ahead and answer this.
So in 2013, those funds that were appropriated in 2014 were allocated to 4 programs. Last year, the governor mentioned that there was some adjustments made in legislation in order to improve the impact of these dollars. And so that $2 million appropriation from 15 was coupled with the 16 allocation to make 4 million, and that's the award that's being announced here today.
And is it being awarded sort of in fiscal year mentality, so it becomes available? I mean, is that the idea?
Well,
Or
So we're in contracting with each of these organizations, and the contract will run for 3 years. So it'll be that total amount of money spent over a 3-year period, and then these organizations are matching that dollar for dollar and more.
General Branson, do you have good appropriation in your current budget?
Yes, we do.
How much is that?
It's 2 million.
Governor, the Senate just defeated a bill that would allow psychologists additional training to prescribe psychiatric drugs. Is that something you're in favor of, address the psychiatric shortage? Perhaps somebody.
Well, that's really a scope of practice issue between the different specialties. I think I would rather let the doctors respond to that.
Yes. The prescriptive authority for psychologists was viewed by the Iowa Psychiatric Society as something we were opposed to. We have a great relationship with psychologists, but as far as a scope of practice, the complexity of the psychiatric patients comorbid with a lot of medical issues. I'm an inpatient psychiatrist, and I have some of the toughest patients, and some days I struggle with some of the psychotropic medications. It's very hard to do. There's a lot of drug interactions, and there's a lot of side effects that need to be monitored very closely. So it's going to take more than just a few week or even a year training. It takes many years of training. So that's why we were primarily opposed to that. Another point I wanted to make, there's a huge advantage of having psychiatric residents. Even though they're training, they can actually be fairly instrumental in providing services to our community. In our program, where we're developing our curriculum, a lot of these psychiatrists, residents in training actually have a lot of autonomy. They will be able to go out to communities. We'll be able to establish telepsychiatry. So I think we're going to be able to reach into a lot of rural areas that are untouched at this point. So even though they're in training, and some of them may leave, but the majority will stay, during those 4 years we have them, they are going to be committed to serving our patients in the state of Iowa.
what is the current setup of such medical residency programs in the state when it comes to psychiatric? I mean, these are a creation of them, but what is the current?
It's typically a 4-year program.
I mean,
Yes.
how many programs are there in the state right now?
Just the University of Iowa currently has a program, and that's it for now. There's Creighton, and Minnesota has programs. Wisconsin, neighboring states have them, but we only have one program in the state of Iowa. Currently, we're looking at having six resident physicians per year. For Mercy, I can't speak to Unity Point and Broadlands. I think with their
Current plans are for 4 residents, so there'll be a total of 16 residents.
We just talked about something else, Governor. This is a long week. This is an important week of the
Okay, well,
legislature.
we're done with the questions on this subject first. We'll do this subject first, then we'll move on.
Based on the answer given to Richard's question, would you be unlikely to sign that bill?
Well, it's my understanding that
Bill is not moving.
If it is-
Well, I always reserve judgment until I see things in its final form, but I think you've heard the answer, and you can see that the medical experts have some strong feelings. The psychiatrists feel that maybe the training isn't adequate for psychologists to be prescribing these particular type of drugs. We want to protect the safety and well-being of the people of Iowa, so we have to be careful and thoughtful in terms of what changes we make in scope of practice for the various professions that are licensed. Okay, if there are no other questions on this subject, we'll open it to other subjects as well. So I want to thank the doctors for joining us today, and thank you for the commitments that your organizations are making to this psychiatric
What
residency.
your priorities are.
Well, we continue to work on the priorities that I spelled out in the legislative session. My top priority is to extend the a 1 cent sales tax for school infrastructure, and also provide funding, long-term reliable funding for water quality. That bill has passed out of the Agriculture Committee. It's now in Ways and Means. As a Ways and Means bill, it will be eligible for the rest of the session. A lot of the issues involved appropriations and Ways and Means are not subject to the funnel. Other issues, I actually will be signing one of our priorities this week, which deals with juvenile records, making it possible for juvenile records to be kept confidential unless it's a serious type of crime committed by a juvenile. This was a high priority of the NAACP and many others, and passed, I think, overwhelmingly through both houses. So that'll be one of my first priority bills to be signed. We'll be working through the legislative process on other items as well. But our main focus, and I've spent a lot of time and spent several days in Southeast Iowa last week, meeting with local elected officials, meeting with agriculture and business leaders with regard to our Save for the Future proposal, which both extends, and meeting with school people too, and with superintendents about extending the sales tax for school infrastructure and for water quality.
Speaking of schools, the Senate voted out a bill that would create more oversight of private facilities that may offer more, kind of overseeing some of these programs that apparently didn't have regulatory oversight, specifically Midwest Academy. I believe it is subject to the funnel week, so it has to pass out or advance a little bit further in the House. House has been pretty general about their support of it. I'm curious if you think that needs to pass this session.
Well, we just recently became aware of the problems with this academy in Keokuk. And as you know, it was not a licensed facility, so it was not under the regulatory authority of the State Department of Education. But, you know, I always reserve judgment on these kind of proposals till I see it in its final form. I think it's important that we do what we can, protect the safety and well-being of children that are in facilities in our state, whether they're licensed or not. So I think it's important that we certainly look at what we can do to make sure that the safety and well-being of children is always protected.
Do you think it should be licensed? The bill as written doesn't, it's not technically a license to operate. Do you think it should be a license?
Well, again, it depends upon what they're doing. Is my understanding they were not offering education degrees and things like that. And so we accredit facilities that do. I mean, we have public schools in Iowa, we have non-public schools that are accredited, but this is not an accredited institution, as I understand it. Primarily focus was on children with behavioral problems, as I understand it. Although I really don't know a lot of the details. I just know that as of now, the students have left and the faculty are gone. But I think it's important that we learn from what happened there to make sure that the safety and well-being of children in our state is protected.
If we don't advance this bill this week and it dies in the session, I mean, the system that we have in place right now, there will be some, facilities, some private facilities that offer services to students under 18. I'm just curious if
The other question is, it's really more of a human services question, probably than an educational question, because they're not offering degrees. So it really gets into whether the, human services department should provide oversight to make sure that the safety and well-being of these children is protected.
Well, if the legislature doesn't act, then you act as an executive.
Well, we can certainly respond, and I think we need to be attentive to concerns and problems that come to our attention from the public, from students, from citizens. And those things need to be investigated and reviewed to make sure safety and well-being of all children in our state is protected, whether they're in a facility like this or not.
A national group last week
closing the Eldora?
No, we're not looking at closing Eldora. I would point out there were a lot of problems at Toledo. There were children that were being abused, their education was being denied. There were just a whole lot of problems, and I put together a group of citizens led by Jerry Foxhoven, who made a number of recommendations, and we followed through and made those changes, and those children are now being provided services in accredited nonprofit facilities throughout the state, and they're getting their education, and their well-being is much better protected. Eldora is a little different situation, and you don't have education being denied there, and so I don't see a need to close the Eldora facility.
But you mentioned the juvenile records. One of the other recommendations the interim committee on criminal justice reform talked about was so-called ban the box legislation. It doesn't look like that's going to clear legislatively this year. I'm just wondering your perspective in general. Is that something you think?
Well, the state does not use that. So I would say the state as an employer does not use a box.
There are plenty of private.
But should
Yeah.
private companies?
Well, that's, again, that's a legislative issue that, and different states have done some things there, and some include private, some of them don't. So that's why I reserve judgment on these things. Is it just public employers, or is it private and whatever? And so I've reserved judgment on that to see it in its final form.
Governor, could I just ask one question? We had two very emotional subcommittee hearings here on the death with dignity bill. Have you got a position one way or another on that subject, doctor-assisted suicide?
I'm pro-life, and I think that bill is dead for the session. Thank you.